Turns out millions of Americans are getting amputations when they don't have to. Leila Feinstein explains the health warning signs you need to look out for to avoid an unnecessary operation.
Imagine having your leg amputated and finding out later that it was unnecessary. Unfortunately, that's happening to thousands of people. In fact, there are 88,000 non-traumatic amputations in the U.S. every year. That's 1 every 6 minutes. Amputations that aren't the result of an accident or unavoidable industrial accident, but because of a circulation problem or infection that could have been prevented. 56-year-old John Bolden doesn't just walk down the street, he struts. Walking on 2 legs was something he took for granted until he almost lost one.
Well, yeah, they would have cut my legs off.
That's because when John went to his doctor with pain in his calves when walking, doctors performed an angiogram and discovered John had poor blood circulation in his legs.
Once we have these studies, we bring them back and we do an angioplasty or place the stent to dilate the arteries to improve their blood flow.
Unfortunately, many patients don't get to a doctor in time, and left unchecked, John would have had to have his leg amputated.
I had no circulation down here, and I didn't even know it because I wasn't a diabetic.
It's true, diabetics are at risk for this condition, known as peripheral arterial disease, or PAD. But smokers are also at risk, along with the elderly and people with kidney disease.
We're trying to heighten the awareness of the symptoms of PAD to get these patients in before they need an amputation.
Dr. Rubin says it's critical. If you have any symptoms like cramping in the back of your calves or any open wounds on your legs or feet that won't heal, go see your doctor immediately and make sure they test your blood circulation.
That's why you go to the doctor, for them to find things before they happen. Not when you get too late. Oh, it's screened, we gotta cut it off. That could have happened to me. So I'm so glad and thankful that they caught this just in the nick of time.
And it's true, they got to him just in the nick of time. But there are so many other people out there who have symptoms but don't get them checked out. And if you wait too long, that could result in an unnecessary amputation. For more information on the symptoms and where you can go for help, go to KTLA.com/health. Back to you.
Leila, thank you. Across the country.